Swati, did you know I love to cook? I love to eat. I sometimes even grow my own food. And this month's podcast for a mid-month meeting of the minds is with Dr. Jaclyn Albin, who is not only an internal medicine specialist, but she's also a pediatrician and she's board certified in lifestyle medicine and culinary medicine. Whoa, what is all that? Well, culinary medicine is a specialty I never knew about. And you know what? It may not be too late for me to change from an OBGYN to a culinary medicine expert. Let me let Jaclyn, Dr. Albin, take it over and let her tell you a little bit about her passion for her career and why is she a lifestyle and culinary medicine specialist.
Awesome. Well, thank you for having me. Delighted to be here. And I think I love the way that you framed that around talking about my passion because I think finding and then living out and being able to do our work tied to passion is how we don't burn out. And so that has been critical for me. I love
So
to
well
say that,
said.
yeah, thank you. Culinary medicine saved me from quitting medicine. And it all began really, I have deep roots, you could say, in food because my grandparents were farmers. So I always knew food mattered and cooking mattered. And then I went to medical school, first person in the family, didn't know what to expect. You just do what you're supposed to do and learn what's put in front of you. And then it was during my residency training in med peds that a few family members had medical illnesses that were tied to food. And they needed to change their diets to treat one illness and in another case to reduce risk of something coming back. And they turned to me for support, and I had no idea what to tell them and felt distraught about it and thought, like, if a pediatrician internist doesn't know, who does? So I started studying the role of food and health, and that was the beginning. But it wasn't until I was early facultyhood here in Dallas, Texas, that I first was introduced to culinary medicine and thought that is what we're missing, teaching people how to make delicious, nutritious, affordable food to treat medical conditions and prevent medical conditions. What a way to deliver care to our patients.
So well said. You're right. I definitely think sometimes in medical school, they forget to incorporate. I mean, there's a limited amount of time, don't get me wrong. Um, but all too often society looks at physicians as if we're just pushing pills, but we're not. It's just challenging with today's lifestyle, especially in the United States, to incorporate healthy, happy food. People don't even always think about healthy food as being happy. And I think when we spoke last time, you had said it can be joyful. Like eating healthy food is not meant to be a punishment. If I remember, that's one of your things that you said to me. And tell me a little bit more about this. How did you discover it? How did you find there's a board certification for culinary medicine? And where does that come from?
Yeah, no, I think when you do anything outside the box, you have to start by recognizing that you're looking to fill a gap. Something's missing, and that is why you're seeking something else. And I was on this journey of trying to understand, where do I learn these things? Who else is thinking about this? Am I crazy? Because I felt that way for a little while. And I had seen the power in my own family of changing our diets, of being empowered to make food that we thought was delicious, that we could do forever, too. That's the other piece about it. It's not this, do this for 6 months and then you're good to go. It's how do you build a sustainable life change related to food? And it was related, it was my parents, it was my kids, my husband, we all had to do it. And then in my professional work, I had started teaching nutrition to medical students through cooking, and they loved it and thought, now we know how to talk to our patients not about nutritional concepts, but about food. So that was really the birth point of it. And I serendipitously ran into Dr. Tim Harlan, who founded the American College of Culinary Medicine many years ago, actually. And he started doing this in New Orleans at Tulane in partnership with dietitians and other chefs. He's a trained chef. And we met at a conference, and he said, you are basically doing culinary medicine. Let's partner up and let me share what what I've learned, what I've created in terms of curricula. And that was the launching pad for us was random connection at a conference, which is always a fun thing. And then seeing the potential to not reinvent the wheel, but then to bring this to our medical students.
That's fantastic. Oh my God. You sing to my soul with everything you just said. And for the audience, no, this conversation is not fully scripted. She really sings to my soul. Um, and that is how we met, actually. So I'm going to highlight a few of your points back to our audience. Number one, the power of networking at a conference. You never know where it might lead you. And number two, that's how you and I met, Jaclyn, is from the American College of Culinary Medicine's annual meeting in New Orleans, which is where I live. I never met Dr. Harlan. I think those days when he started this program 11 years ago, I was doing locum tenens work. So I was on the road practicing rural medicine for OBGYN patients in Hawaii, New Mexico, Maine, as rural as you can get. So, anyways, I do think what you've described is so valuable. It's a pivot point. It needs to be sustainable. We don't have to live on fast food forever, although sometimes it feels convenient, but there are many shortcuts in cooking. Um, and everything you said is so exciting. I can't wait for this next year's meeting for the American College of Culinary Medicine in 2026. And I'm not saying that just because I want more people to come or because it's in New Orleans, but it was a really meaningful meeting to me where I met you. So,
Well, I think it's
um,
because everyone there wants something more. They want something different for themselves. They want something more for their patients. And that's part of why this is a win-win. And I was just imagining you trekking all over doing rural OB-GYN. Food mattered in a different way to every single one of those patients. And each of them had different challenges in where they bought their food, how they accessed it, what resources they had to prepare it, what their cultural preferences were that would lead to what they wanted to prepare. How many people are they feeding? So, all of those questions and things can be weaved into medical care. And to hit on one of your earlier points about what I call medical school real estate, it's like New York City real estate in medical school, but the way I like to reframe it is it's not cramming nutrition in because it has to be there. It's finding a thread because it is relevant to everything. And it's not that we can't afford to teach it, it's that we can't afford not to teach it because it is relevant to everyone, everything, every specialty, every condition, every age. And so finding a way to not make it a standalone, like isolated course, but something that's a thread starts by teaching students themselves how to make food that feeds them well and nourishes them. And then they can be innovators in patient care. And that's really what we started with the students. We teach residents. And really, what I'm super passionate about now is we've made this a clinical model. So I'm a primary care doctor, but I see my patients in the kitchen now. And we meet in groups in community kitchens where we're able to bill health payers and really tie it back to their diabetes, their heart disease, their blood pressure, their constipation, whatever they're facing. We're teaching them how to prepare the food we want them to eat, and we're giving them a safe space to try it while being able to do this in a traditional billing model.
that is fantastic. That is brilliant. I love it. I cannot say more about it. I mean, what an incredible tool you've built and what an incredible community building skill. I mean, not the skill, it's this powerful thing for the community you care for because they're learning more than just taking a pill, which all too often is what society thinks we do as physicians. And we do so much more than that. And unfortunately, there's not enough time to do everything, but meeting your patient in the kitchen is brilliant. I mean, everything I know, like from drinking adequate fluids, but what does that mean? It's good for your kidneys to drink adequate fluids, but what does that really mean? And does it mean can I drink 10 cups of coffee a day? No. So That is just amazing. So, what else? Where else can people find you cooking? Do you have an Instagram account where you're doing cooking videos?
Okay, I'm not super into videoing myself while cooking. I'll usually do a quick description of, hey, this is what we made for dinner when we didn't have anything left in the fridge. But yes, I am on Instagram at JL Albin MD, so JLALBIN MD, and I post when I feel like it. So you will not consider me a content expert probably because you're supposed to put stuff out there regularly. But I am there, and then I do a lot of academic publishing as well, and we actually wrote about our culinary medicine clinical service line in New England Journal Catalyst. So people can find that open access if they just Google any JM Catalyst culinary medicine. I'm pretty sure we're the only paper on culinary medicine that they've ever published. But we talk about you can make this part of your clinical work today with additional training, even in a broken system. And you've kind of alluded to how easy it is for us to just keep eating the way we're eating. We have to be willing to disrupt the systems of our lives and our medical practices if we want things to be different. And I am in a situation right now where my kids are observing, they're young teens, they're observing their dad not loving his job. And he's not a physician, but he's hoping to make some transitions. And then they observe their mom loving her job. And they get to see what it looks like to work hard, but to also be incredibly fulfilled and passionate about what you're doing. So, doing something unique like this in medicine is about so much more than just the thing itself. It's also about finding deep career fulfillment and modeling how we should strive for that in those that we mentor, whether it's our own children or other mentees.
Every single time I do one of these podcasts, I find myself learning and being so impressed, just admiring the people I meet with. I'm grateful to have met you. Oh my God. But what you said is true. We need to start at home first. If I feed myself well, I'll be able to take care of my patients better. If I feed my children well, they'll be happier. I'll be happier. So it's easier to almost preach what you say if you're doing it already. And yeah, and same, especially in medicine, I mean, people ask me like, "What are you glad do you miss it or what?" And I don't miss 80-hour work weeks because we didn't have time to eat properly. Now I actually have time to cook dinner or, you know, even just eating fruit. It takes a few minutes. You can't just like slurp down a protein shake. That's not the same thing. And so we do have to be willing to disrupt the old behavior and take the time to eat a proper meal and enjoy your food.
Mhm.
You shouldn't be eating to punish yourself. You're eating to reward yourself, and that doesn't mean 10 pieces of chocolate. That means eating healthy food that tastes good and is good for you, so you feel good. And I think, like I said at the beginning of this podcast, I didn't know this career option existed many years ago because it didn't. And how many years ago did you discover it? You said you were in medical school, and I'm not trying to get at your age, but just to get a time frame of how long culinary medicine has been embraced by modern medicine, because like you said, and I agree, we have to disrupt the old ways.
So
So
I would say we're still just at the cusp of this being embraced by modern medicine. And that is part of why I moved away from strictly focusing on education in and turning this into a clinical model and really proving that this is something that we can do with our patients right now, even in the things that are broken about our healthcare payer systems. I started teaching culinary medicine to medical students almost 10 years ago and discovered culinary medicine as a formal field, that there were other people doing this all over about 9 years ago. And if you look at the medical literature, there have been three culinary medicine focused scoping reviews in medical education published. One was from my team, which was a little bit of a smaller scope, just looking at US medical students. And then the most recent one by Caitlin Hildebrand and colleagues looked at medical school and residency, US and Canada, and you'll just see explosive growth across all levels of medical education. Most of these are led by what we call nutrition champions, which are people, and typically physicians, who really see what's missing, believe in this, and want to teach the next generation to do more. But I think the next 5 to 7 years, we're going to see this is happening in patient care. It's happening in research. Patients are asking for it because patients want more. And what we're able to give them, and it's never a dismissal of the conventional strategies. I always like to say this is the yes and approach, like improv, where we're saying this has been missing. Not that we're cutting out the other strategies, but we're saying that our patients want to talk about food and they can't always access a registered dietitian. If they can, awesome. And we partner with them immensely. My main culinary medicine partner is a dietitian, but many dietitians don't have culinary training either. So how do we bring culinary training to everyone to level up how we can talk about food instead of nutrients in healthcare?
That is amazing. I'm going to close out our podcast with a reminder for everyone to follow Health Meets Food, which is the American College of Culinary Medicine's Instagram channel. Or they can, I do occasionally post videos of my food. I make omelets. That's usually the one I make show. Or sometimes there's other cooking videos, but there's also a lot of other stuff that's on my Eat, Move, See Travels Instagram. The PlansConnect account, which is where this is going under, doesn't talk about food, but it probably should. And one day I'll marry the two. So, Dr. Alvin, thank you so much. You're inspiring. And yes, let's talk to our patients. Let's talk to ourselves, our families, and make food a joyful experience to make our bodies healthier, make our communities better.
Thanks
Thank
for having me. My closing tip for everyone is find a way to put color into your food in the coming days, especially throughout the holidays.